And within 6 to 8 weeks, he said, you know those voices that I hear all the time? They're going away. And then probably another 2 weeks later, he said, you know how I've always thought that there were all these people targeting me, that they were tormenting me on purpose, that they had technology that could read my mind and they were broadcasting my thoughts to everybody, and they were purposefully ruining my life. It's like, yeah, I'm thinking to myself, yeah, we've talked about that about a million times, I think. And yeah, I remember that. He said, I don't think that's really happening.
Oh my goodness.
And now that I say it out loud, it sounds kind of crazy. Maybe it never was happening. And maybe I've had schizophrenia all along, like everybody was trying to tell me. And it's going away.
What are you thinking as you were hearing this unfold?
I was initially thinking there's no fucking...
Hey, what's up, family? I'm Rachel, and I am one half of Two Crazy Ketos. And today, it is my honor and privilege to be able to talk with Dr. Chris Palmer. For me, getting to see you in person is so amazing because you're speaking about mental health and how this way of eating, how nutrition can speak into concerns of the brain. And that has definitely been a lifelong battle for me personally. After being medicated most of my adult life for anxiety, depression, social anxiety, I tried to attempt suicide 2 times, and to think about how changing my nutrition could change my life and what's going on in my mind, even in my thoughts, and the clarity that I have now is overwhelming, and I'm not alone. Nutrition can change that. Can you talk a little bit about that?
Well, I'm sorry to hear how difficult your life has been, and thank you for sharing that so openly. To most people, this is incredible, and and I mean incredible and not credible. This
Right.
is not credible.
That's right.
It's a diet. A diet doesn't change a serious brain disorder.
Yeah.
And so the great news, in addition to all of the clinical cases that I've got that have been published in peer-reviewed medical journals, all of the researchers from around the world that I'm working with who have seen similar results, all of the scientists, neuroscientists, psychiatrists who have published neuroscience reviews connecting the dots between the ketogenic diet and what it's doing to the brain for epilepsy, and what we know are the problems in people with mental illness, including anxiety, depression, but also schizophrenia, bipolar disorder, all of the mental disorders. We've got all of this evidence. We have lots of researchers hopping on board this train, and the biggest gift to me as a psychiatrist trying to do this work is the epilepsy field.
Yes.
So I don't talk about this as a weight loss diet, and I don't necessarily talk about it as a type 2 diabetes treatment, although the connections between obesity and type 2 diabetes and mental illness run deep and long. And they go, so most people think the reason people with mental illness have higher rates of obesity and diabetes is because of the pills we prescribe.
Okay.
And there's no question that is true. The pills we prescribe cause all of those things and more. But in fact, the connections between mental illness and obesity and diabetes and premature mortality date back to the 1800s, before we even had these pills. So there's something about the disorders themselves that are closely related to things like diabetes. More importantly, there's something about these disorders that are very closely related to what we call epilepsy.
Right.
And we use epilepsy treatments every day in tens of millions of people. Things like Depakote, Tegretol, Lamictal, Topamax, Neurontin or gabapentin, Valium, Klonopin, Xanax. All of those pills are anti-seizure pills.
Wow. Wow.
And you've probably been on
Yes,
some
I
of
have.
them.
I know. As you're listing them, you're correct. I have been. I have utilized those.
So those are epilepsy treatments, and we use those every day in tens of millions of people with mental illness. And guess what? When those pills fail to stop seizures,
Right.
the ketogenic diet can do the job.
Wow.
The ketogenic diet can stop seizures when those pills and even brain surgery don't work. So, given all of that, given all of the neuroscience, given all of the clinical observations, given that we use epilepsy treatments every day in tens of millions of people, and the ketogenic diet is an evidence-based treatment for epilepsy, it is a no-brainer to be thinking about using the ketogenic diet for chronic, serious, treatment-resistant mental disorders.
Oh my gracious. Now, when you began your career, were you aware of this?
No.
How did you come to it? How did you find out?
So nobody teaches this in any medical school or
No.
psychiatric training program or anything.
Right.
So, you know, it's interesting. So like everybody else in this field who's doing this work, I stumbled upon it.
Right. We're just
myself.
following in the keto hole, right? I literally feel like we just stumbled upon health and wellness.
Yes. And that's, so for me, it started with my own personal story. I had had a history of depression when I was young, but when I was in my 20s doing my psychiatry residency, I was not clinically depressed at that point, but had metabolic syndrome already.
Wow.
And so I was going year after year to the doctor. He kept telling me to do a low-fat diet and exercise. I was doing a low-fat diet. I was exercising. It wasn't working. My blood pressure kept going up. My cholesterol was getting worse. My prediabetes was about to turn into diabetes. It was all...
Yeah.
And I was only in my 20s.
Right.
I was like, this is not okay. I'm a
Right.
doctor. This is not okay. I do
Yes.
not want to be having a heart attack when I'm 45.
No.
And so as a last-ditch effort, I decided to try a low-carb diet, known as the Atkins diet at that point in time.
Yes. Mm-hmm.
Decided to try the Atkins diet, and lo and behold, within 3 months, it worked for everything I wanted it to work for. It improved my metabolic syndrome, my blood pressure plummeted to a good, healthy level. My LDL cholesterol actually went down.
Right.
My good cholesterol went up, which is what you want. My triglycerides went down. Like all of the biomarkers got better.
Yes.
But the icing on
Reintroduction.
the icing on the cake that I noticed was my mood was so much better. I had energy that I had never had in my whole life.
Yeah.
I had motivation. I was sleeping better. My sleep was actually restful. I didn't have to push the snooze button a million times
Yeah.
and then grudgingly get out of bed. Like everything was better. And you know, it's interesting because I remember that time and I remember thinking that there are people in the world, it's probably genetic. There are people in the world who are happy, peppy people.
Oh, wow. Yes. And I'm just not that person. That's what I
and
thought.
that's not me. No,
Yeah.
there are happy, peppy people, and they like to work hard and play hard. And I was somebody who I worked hard. I got through medical school and residency, and you have to work hard to do that. And I was a hard worker.
Yeah.
I could never understand who the hell wants to play hard.
Right.
Why, aren't you tired? Like, why would you want to play hard after you've worked so hard? Like, who's got energy for that?
I've got nothing left in the tank.
And I just figured there are haves and have-nots, and I'm just a have-not. I'm
Yep.
just one of these people who is tired, and I just have to force myself to work hard. And when I changed my diet, I became a happy, peppy person who wanted to work hard, play hard. And I was like, I've never been this person in my whole life. How the hell did this happen?
Right.
And I quickly realized, I started recommending the diet to friends and family who wanted to lose some weight. And they were reporting the same thing.
Yeah.
They were all reporting, oh my gosh, I feel great. So I quickly started thinking about, I wonder what would happen if we use this in treatment-resistant depression patients.
Okay.
Because I have so many patients who have tried pill after pill.
After pill after pill.
After pill after pill. They've tried years or decades of psychotherapy. They've been in and out of hospitals. Some of them had even had shock treatments. Nothing was working.
Right.
So I was like, well, what do we have to lose?
Yeah.
We don't have anything else to offer them.
Yeah.
They've pretty much exhausted all of the options. So I'm going to try this diet and see if it works. And lo and behold, it did.
You saw the results.
I saw the results. I think the game changer for me was in 2016 when I had a patient with schizoaffective disorder, which is kind of a cross between schizophrenia and bipolar disorder. He asked for my help to lose weight. And so I put him on a ketogenic diet. And I really, like, depression and schizophrenia are very different things.
Yes.
I knew it worked for depression.
But would it work for this?
I didn't think it was gonna. I didn't even challenge that. I was just trying to help the guy lose weight.
Yeah.
I was just like, I'm just gonna help him lose weight. That's my goal. I'm not. There's no way in hell this would. If anybody had said to me at that moment, this might stop his hallucinations, I would have said, you're crazy.
Right.
There's no way in hell a diet is going to stop hallucinations. You don't know what you're talking about. Schizophrenia is a lifelong, debilitating, chronic disorder.
Yeah.
Like, no way in hell is a diet going to do anything for that. So here I am trying to help the guy lose weight. Within like 2 or 3 weeks, I noticed this powerful antidepressant effect.
Wow. Okay.
And he's making better eye contact, and he's smiling more, he's talking more, and I'm like, what's gotten into you?
Yeah.
And I thought to myself, well, here's that antidepressant effect that I've seen before. But he was still psychotic. He still had hallucinations, still had delusions. He was just happier and psychotic. And I figured, oh, well, you know, hey, little weight loss, or maybe that keto diet, doing that
Giving a little pep in the step.
antidepressant thing. That's great. That's great.
Yeah.
Took about 6 to 8 weeks. And within 6 to 8 weeks, he said, you know those voices that I hear all the time? They're going away. And then probably another 2 weeks later, he said, you know how I've always thought that there were all these people targeting me? That they were tormenting me on purpose, that they had technology that could read my mind, and they were broadcasting my thoughts to everybody, and they were purposefully ruining my life. It's like, yeah, I'm thinking to myself, yeah, we've talked about that about 1 million times, I think. And yeah, I remember that. He said, I don't think that's really happening.
Oh my goodness.
And now that I say it out loud, it sounds kind of crazy. Maybe it never was happening. And maybe I've had schizophrenia all along, like everybody was trying to tell me. And it's going away.
What are you thinking as you are hearing this unfold?
I was initially thinking there's no fucking... Sorry if you have to bleep that.
I can totally imagine, because yes, I mean, you talked so
There's
much.
no way this is happening. This cannot be happening.
Right.
This is impossible. The good news, I guess, for me is that his father was very actively involved in his life and his care. And he also had been seeing a psychologist for extra therapy. And so I was able to ask both of them. And I had to go to both of them on like 2 or more occasions.
Yeah.
Are you seeing what I'm seeing? Because I'm having trouble believing what I'm seeing.
Right, exactly.
This cannot be happening. He's really getting better. Like, his schizophrenia is going away.
And their response is they're seeing the same thing?
Their response was, yeah, we're in disbelief too, but you're not crazy, Dr. Palmer. It's really happening. This is really happening. What is this? What is going on? And at that point, I knew, because I used the keto diet for my own weight loss and for my own metabolic syndrome.
Right.
So I knew that it could be used for diabetes and weight loss. I did not even know that it was used as an epilepsy treatment at that point. I had never heard of that. But when this starts happening for my patient with schizophrenia, I start researching the literature to try to figure out how can I explain this? How can I understand this? This is like something I can't sit on. Somehow I'm going to have to write a report about this or something.
I've got to tell somebody.
I have to tell people, but I need to understand, like, how is this even possible? Like, how can I make sense of it?
Right.
And then I came upon all the epilepsy literature. And then it was like, oh my God, this is a no-brainer. Well, wait, if it stops seizures, we use seizure treatments all the time in psychiatry. Right. And if this diet can stop seizures even when the pills don't work, maybe that's what it's doing for him.
Which is, it's so nice to hear a doctor this excited for the transformation in their patient's life, because this is such a hard topic to bring up, and you bring so much dignity for the patient. And I heard you talking about that, like, you know, the dignity, and that is something that I've struggled with. It's hard to admit you're having a problem. It's hard to bring this problem. Even talking about it with coworkers, or like, hey, I'm struggling with this, and I'm just basically just trying to manage the chaos as much as I can, so that I can still hold down a job, or I can still raise a family in some way. But yes, the transformation in your life and what you're able to do once you utilize this nutrition, pills could never do this for me. There was no pill that would have this sustained result. And so now, what do you do? How do you bring it to the rest of the community, of the medical community?
So I am working on that. Before, I want to just make one quick comment for people who may not know this, though. So they may hear your story and think, well, you just had a treatment-resistant case.
Right.
You just had a really bad, difficult case.
Yeah.
Because other people have depression and they get better. Mm-hmm. Other people have anxiety and they get better.
Yeah.
And I want to make clear, mental disorders are the leading cause of disability in the United States and on the planet right now.
Yes.
Not because people aren't getting treatment, because our treatments fail to work for far too many people.
Oh, wow.
You are not alone.
Thank you.
In your frustration and misery and suffering and trying pill after pill after pill and getting nowhere. Your story, sadly and tragically, is not a rare story. And in fact, researchers did a study on hundreds of people with chronic depression and followed them for 12 years. 90% of them, 90% of them still suffered from depression on and off over those 12 years. Even though they were all taking pills, they were all getting therapy, they were doing what they were told to do by their mental health providers, they were not getting better.
Right.
And so we need new treatments, and that leads directly to what you asked me, which is how do we disseminate this?
Yeah.
People are desperate. People who have mental illness, their family members, the insurance companies who are paying for this treatment, the disability payment system that is paying all of these disabled, miserable, suffering people.
Yeah.
Everybody wants better solutions. And so I quickly became convinced that I can't sell this treatment by saying the keto diet works. Mm-hmm. Even if we do research studies, the keto diet works. Nobody's going to really believe it. It's not going to transform the mental health field.
No.
And the reason I became convinced of that is because we already have an abundance of treatment studies showing the ketogenic diet is effective for weight loss. Most medical doctors won't.
They don't want to hear it.
They don't want to hear it, and they won't prescribe it. We have good evidence. An abundance of evidence, actually. Keto diet improves diabetes and can put it into remission even.
Yes.
Most healthcare professionals won't recommend it to them.
No.
We have gold standard medical reviews, keto diet for epilepsy. Mm-hmm. Most neurologists still won't recommend the ketogenic diet to their treatment-resistant epilepsy patients. They would rather have their patient seize day after day and suffer a disabled life than recommend, God forbid, the ketogenic diet.
Wow. I mean, it's the truth. It is the absolute gospel truth. So how do you present it without saying keto?
So what I did is I did an even deeper dive into the science. And I realized I need to connect the dots even more to be able to understand how and why people should take this seriously as a treatment for mental illness. And so I've been working on this for like 5 or 6 years. And I already had a pretty good start because I've been a psychiatrist for over like 25 years now.
That's not possible because
And,
you look like you're 25 years old.
Well, thank you, but low carb lifestyle.
That's right.
Anti-aging. But so I already had a really good solid foundation of the neuroscience and clinical evidence and other stuff of mental illness. And as I started doing more of the scientific research on how and why a ketogenic diet might put these illnesses into remission, I ended up connecting a lot of dots that to date haven't been connected.
Yeah.
And in the end, I am going to be proposing a new theory of what causes mental illness. And I will be arguing in a book named Brain Energy.
Yay!
I will be arguing that all mental disorders, all of them, even alcoholism, even eating disorders, but definitely schizophrenia, bipolar, depression, anxiety, post-traumatic stress disorder, all mental disorders are metabolic disorders of the brain.
Wow.
And once you understand, so in order to do that, I had to dive deep into the science.
Yes.
And I will just go ahead and say it. My book is a science book.
Okay.
It is written for the general public. I bent over backwards to make it understandable and easy to understand, but it does include some cell biology science. I explain it so people can get through it,
Right.
but it's not just a quick self-help book of eat keto and that'll cure your schizophrenia.
Thank you. Thank you for that. Yeah. Well, and we want to know. Like, I want to read it. I want to learn the science. Like, I think that that's great.
Good. So the goal of this book is to present a unifying theory of mental illness, that mental disorders are metabolic disorders of the brain. Once people understand that, they will understand why an intervention like the ketogenic diet, but also why kind of tried and true interventions like good sleep,
Yes.
stress reduction, managing substance use,
Yes.
limiting alcohol, tobacco, marijuana, other substances that can impair metabolism. This theory connects all of those dots to reveal new treatments that can heal the brain, that can allow people to put into full remission
Yes.
chronic disorders like anxiety and depression and suicidality, but also schizophrenia and bipolar disorder.
Yeah.
And the really exciting, I mean, there's so much exciting news about it, but one more exciting piece of news from my perspective is that I've already got 15 endorsements, and some of them are from the leading psychiatrists and neuroscientists in the world.
Wow.
Who have read my book and said, this is potentially paradigm shifting news and information. And what that means is that the medical field cannot write this off and say Chris Palmer is just a quack.
Wow.
Because I have leading psychiatrists and neuroscientists who are publicly backing this, saying, wait, he's onto something. We need to have a serious discussion about his theory. Now, is it possible I got some parts of it wrong? Yes. This is an ambitious theory.
I was going to say, this is brand new. Like, I mean, we're in brand new territory.
Brand new. And I am trying to unify the entire mental health field and connect it with the metabolic field.
This is a lofty goal, sir.
It is a lofty goal. And I'm not that smart. So
I don't know.
So I might have made a mistake or two here or there. But I've had some really smart people read it, and they are really impressed with it. So I am hopeful that it will change the conversation. And the reality is that I'm also mindful of what we are up against.
Yes.
We are up against powerful corporate forces that have multi-million-dollar drugs, sometimes multi-billion-dollar drugs,
Yes.
that are being used in millions and millions of human beings around the planet. Even though they don't work, that doesn't matter to those companies.
That's right.
Those companies are making a lot of money
Yes.
off of these drugs that don't work.
It is challenging to think, for ourselves, like we've spent a tremendous amount of money as a family to pay for the pills that I no longer take. It's a lot cheaper on our grocery bill. Now we feed my mental health with things like ground beef and a couple of eggs. That's a lot like lighter on the wallet for the patient as well. And then to have the results. Is it because nutrition is just too simple? We want to overcomplicate it?
So that's the really fascinating thing is I knew, because there's a whole field called nutritional psychiatry that's trying to argue eat a healthy diet and you'll have a healthy brain.
Yeah.
And that's pretty much going nowhere.
Right.
Because a healthy diet is fruits and vegetables.
Yes, right. So it's like you have to redefine healthy
and of course
diet.
of course you can still have your treats.
Right.
Like everybody should be able to have their treats. So eat your fruits and vegetables and have your treats. And healthy diet equals healthy body should equal healthy brain. We have long known in the mental health field that doesn't work. That doesn't work for disorders like schizophrenia and bipolar disorder. So my book does this deep dive into the science to connect the dots. So I actually think the ketogenic diet, I don't think of it as a diet.
Yeah, right.
I think it is a diet, but I don't think of it as a diet. I think of it as a metabolic therapy or a metabolic intervention.
Yes.
It is having profound effects on body and brain metabolism, and that can allow the brain to function normally again, and over time can actually allow the brain to repair itself.
Yeah.
So that if somebody goes off the diet for a few days or a week or two, they won't necessarily develop symptoms right away.
Okay.
But I am hoping that by convincing people of the complex science that I've connected, once they get that, then we can move on to, and by the way, if you want to rebalance those neurotransmitters and decrease that brain inflammation and change the gut microbiome and change hormones and do all of these things that we want to do, guess what? The ketogenic diet is one option.
Yes.
And then we've got simple interventions that are implementable, that we can empower people to do. And some people are going to need help. And let's just be clear about that. No apologies needed.
No.
People might need help. They might need coaching. They might even need a residential or an inpatient treatment program to get them started on a healing journey. And we, as a system, the insurance companies pay for that right now to put them on pills that don't work.
Right.
So why wouldn't we pay for that to help people get started on the journey, allow them to heal? But yeah, I think that in the end, as you say, you're going to save money on prescription medications. You're going to save money on therapy appointments. You're going to save money on hospitalizations. You're going to give more productivity back to the system, because when people are not overwhelmed and disabled by their psychiatric symptoms, they can actually work and produce.
Yes.
And they can live meaningful, purposeful lives. And some of those people will go on to become tax-paying citizens. And like, what's not to love about that? Take somebody who's disabled, who's taking money from the system, and let's turn them into a tax-paying citizen that's actually paying into the system.
Yes.
What's not to love about that? And in the meantime, we're going to reduce this human being's suffering and misery and torment. We're going to give them dignity and self-respect.
Yes.
And allow them to truly hold their head high, because they have conquered mental illness. they have moved on with their life. They are a competent, peaceful, happy human being.
Yeah.
And like, I am hopeful that the mental health field will jump onto this
Yes.
because it is the right thing to do from a scientific standpoint. It's the right thing to do from a moral and ethical standpoint. It's the right thing to do from a financial and cost benefit standpoint. It is the right thing to do, and we have to do it.
Oh, that is so precious to hear. And if I am a patient, somebody's watching right now, and they would like to begin a discussion with their therapist, they want to begin a discussion, with their psychiatrist, where do they begin? If they want to consider the keto diet and just bringing it up, like how can they, present that as like, hey, I'd like to try this?
So most mental health professionals, therapists, psychiatrists, others have never heard of this. Mm-hmm. They don't even know that the keto diet is used for epilepsy. Mm-hmm. They just have heard of the keto diet as a dangerous fad diet.
Right.
So you have to start with that reality.
Okay.
You have to start with the reality that the person you're going to go talk to, more likely than not, their only conception of the keto diet is as a dangerous fad diet.
Yes.
And so what I would want you to do is I would want you to, you can go to my website, chrispalmermd.com.
Yes.
I have a lot of articles, both for lay people, like in Psychology Today, written in plain English, easily understood. Mm-hmm. But I also have several scientific, academic articles that have been published in peer-reviewed, high-impact mental health journals. Mm-hmm. So that will get respect and, from your clinician. And I would encourage you to maybe print out one or two of the high-impact medical articles.
Okay.
Even though you probably won't be able to understand what they mean.
Right. But this is to present with them.
It's written in medical language. Mm-hmm. But print out one or two of those and take it to your mental health professional and say, there's this guy at Harvard Medical School who is talking about the ketogenic diet being a metabolic brain treatment, and it might help with my mental illness. And here are some papers published by him, and I want to try this treatment. If your mental health professional is still a little skeptical, you could ask them to watch one of my videos. Like, I've done an academic presentation that's available for free on YouTube. All you have to do is search YouTube, Chris Palmer Keto, and you'll get lots of choices. Don't have them look at a podcast. Have them look at one of my formal presentations.
Okay.
Because the formal presentations, I've always got mental health professionals in my mind when I'm giving a formal presentation.
Which I'm really thankful for.
Because I want to persuade them. I want them, and I want to arm patients and family members with the right set of speaking points.
Yes.
And the right scientific knowledge to be able to get their professionals to take, their mental health professionals to take this seriously. So have them watch, free, it's free. I'm not plugging anything, I'm not making a penny off any of this. Have them watch one of those videos if you can get them to do that. But print out the articles, hand it to them, and tell them, I really want to seriously consider trying this diet. Can we talk about it?
Yeah.
If your mental health professional says, absolutely not, I don't want anything to do with this, I'm not having it, then you might try one or two more times with that person. But if that person refuses, you might want to consider just looking. All you got to do is look for a mental health professional who will say, okay, I'll give it a shot.
Right. Just an open mind about it.
And then, if you yourself don't know how to do the keto diet, mm-hmm. I really want you to get good advice. Because, people using it for weight loss, it kind of doesn't matter if they screw up.
Right.
If you're trying this for a serious debilitating mental disorder, you're going to have limited bandwidth and you're going to have limited patience for trying a treatment to see if it works for you or not.
Yes.
So I want you to really make sure you're getting it done right. And you can, if you have enough money to hire a ketogenic dietitian or a keto coach, somebody who knows what they're doing to make sure you're in high levels of ketosis, make sure you're adhering to a good version of the ketogenic diet, and then you're going to be working with your mental health professional, letting them know, like, I want you to help me monitor my symptoms,
Right.
and then possibly help me adjust my meds. Maybe I could come off meds, but that needs to be done safely and slowly.
Yes.
You can't just stop all your meds cold turkey. That's a disaster. I'll say that up front. So please don't do that. But that, with that comprehensive kind of approach, I know a lot of people who within 6 months or a year can be off all their meds, can feel like they have a new life, can be symptom-free, and then you can say, adios, mental health professional.
Right. Which is an unbelievable freeing experience. I mean, it's just absolutely transformative. I mean, I cannot explain to you what my life is like now compared to what it was for so long. Just so long. So I'm so excited for people who may not be aware of Dr. Chris Palmer and what he's doing. Where can people find you? Can you share your website again? Do you have a specific YouTube channel for that you have for yourself too?
So they can find me at chrispalmermd.com. I do have a YouTube channel, but I have not kept it up. So it's only got one video on it, but I'm on lots of other YouTube. So if you search YouTube for Chris Palmer Keto, you'll get lots of videos that I've done, lots of interviews I've done for dietdoctor.com or low carb conferences that have been posted publicly, you know, or Sean Baker, or lots of others. Ken Berry interviewed me. So lots of those are available, all for free, not selling anything. If you want to follow me on social media, I'm most active on Twitter, so you can follow me, Chris Palmer MD, on Twitter. But again, I want to put in a plug for my book, not because I want to sell my book, but because I want to transform the mental health movement. And this book is the way to do that. So Brain Energy, you can pre-order it now on Amazon or anywhere else, but I end my book by calling for a mental health movement. We need masses of people to come out of the woodwork and fight for a transformation of the mental health field.
Absolutely.
And this is going to be a fight because those multi-billion-dollar drug companies are not going to give in easily.
Oh, no.
And they like the system. They don't care that you're still suffering. They don't care that you're still trying to kill yourself. They don't care that you're in and out of hospitals. They don't care that you're a zombie. They don't care that you're gaining weight. They don't care about any of it. All they care about are their profits. And this needs to change. We need a transformation in the mental health field, and it is going to require people to transform this field. And that means you. Whoever you are, yes, I see you right there. I see you. You, sitting there, standing there, you, your friends, your family, you must get involved if you care about this.
Wow. Thank you so much, Dr. Chris Palmer. Well, if you like videos like these, check out some other videos that we have right over here. Or take a look at our most recent video, which we'll place right over here. But whether you head this way or you head this way, don't forget to head this way. Subscribe to our channel and click the little bell icon, and that way every single time we meet a champion for health, you'll be alerted to it. And until next time, bye. Wow.